Welcome back. This is Brilliantist. Here is my girlfriend. If you haven't subscribed, please subscribe. Internal medicine video number 3. Question number 21. Miss Grace is a 65-year-old woman with stage 4 chronic kidney disease secondary to hypertension. Come to OPD because she has dysuria and decreased urinary frequency during the past 2 days. She has not had fever or hematuria. Temperature is 37.3 degrees centigrade, pulse rate of 90 beats per minute, and the blood pressure of 142/85 mm of mercury. That is high. On physical examination, no frank tenderness is noted. Urinalysis shows cloudy urine that is positive for leukocyte estrase, nitrate, and proteins. Results of urine culture are pending. Which of the following medication is the most appropriate therapy for this patient's condition? The answer is D. Oral administration of ciprofloxacin, because as you can see, the patient has raised leukocyte estrase and has nitrate, indicating urinary tract infection. Question number 22. You're called by nurse to review a 66-year-old man presenting with increasing lethargy and confusion. Past medical history include depression, Barrett's esophagus, and benign prostatic hyperplasia. Current medication are sertraline 100 mg, lansoprazole 70 mg twice a day, and tamsulosin for BPH 400 mg. Blood test as follows: HB of 10.4 g per deciliter, sodium of 118, sodium has reduced, platelets of 168 seems normal, potassium 4.1 normal, white blood cell 8.7 normal, urea 7.9, neutrophil 2.5, creatinine 173 micromole, lymphocytes 3.0, eosinophils 0.6, corrected calcium 3.01 millimole per liter, and total protein of 95 g per liter. Albumin 70 g per liter. Urinary sodium 7 millimole. Urinary osmolality 100 millosmoles per kilogram, and plasma osmolality of 280 millosmoles per kilogram. What is the most likely cause of the patient's hyponatremia, as we have seen? The answer is B. Multiple myeloma. Question number 23. A 39-year-old female presents to you in the ward after admission with end-stage renal failure secondary to hemoglobin A nephropathy. She was discharged 3 days earlier following an admission due to collapse in the context of hyperkalemia, potassium 7.8 millimole per liter. She has been transferred to the medical assessment unit, having developed rigors on dialysis earlier today. Blood taken at the end of dialysis revealed white cell count of 15.2 times 10^9 per liter, that is increased leukocytosis. Sodium of 134 slightly decreased to normal, potassium 2.1, and urea 10.6, creatinine 400, and C reactive protein of 119. What is the immediate priority in her management? The answer is C. Intravenous antibiotics. As you can see, the white cell count and other features indicating infection. Question number 24. Mr. Marunde is a 72-year-old man. He is brought to you from a nursing home. He is normal, bed-bound, and suffers from diabetes, peripheral vascular disease, and ischemic heart disease. He has become increasingly drowsy over the past 2 days. He has not been on travel, though he has been ill with a cough the previous days and complained of runny nose. He responds to voice but is difficult to rouse. There is no neck stiffness and the tone is normal in all 4 limbs. Power is difficult to assess, but there appears to be no focal weaknesses. He has responsive pupil and no ophthalmoplegia. He has a systolic murmur head on his chest, has crepitation in the left breast. His observation shows heart rate of 96 beats per minute, blood pressure of 110/65 mm², temperature of 38 has increased, saturation of 96 normal in air, and respiratory rate of 14 beats per minute, somewhat decreased. During examination, he developed a brief seizure lasting 30 seconds, which settles without any intervention. Laboratory findings show sodium of 139 normal, potassium 5.3 normal, urea 8.9, creatinine 120, CRP 90, HB13, platelets 398, white blood has slightly increased 13.2, chest X-ray raised, left hemidiaphragm seen in previous scan, CT of the head, no acute infarction or hemorrhage seen. Which management option should be prioritized as the most urgent? The answer is B, acyclovir. As you can see, this patient has runny nose, indicating he has some viral disease, and as you can see, he's old, 72 years old. Question number 25. Mr. Hamis is a middle-aged man. Present to the emergency department while you are on call with mild epigastric pain and a single episode of coffee ground vomiting. He had no past medical history and was not on any medication. On examination, his heart rate was 70 beats per minute and irregular. His blood pressure was 132/80 mm². Respiratory rate of 12 beats per minute and oxygen saturation of 98 in air. Physical examination was normal. Investigation were as for hemoglobin of 14.5 gram per liter, platelets count of 120 times 10⁹, somehow reduced. What further information is required to calculate his Blanchard score? The answer is E, urea. In Blanchard score, you need to know that it's only urea which is formed among all, there's no age, no creatinine, platelets or prothrombin time. Question number 26. You are the first on call today and you are called by nurse to review a 75-year-old woman who presents to casualty with 2 episodes of coffee ground vomiting and epigastric pain. She had a past medical history of ischemic heart disease and had 2 myocardial infarctions. She had symptomatic angina about once a month. She was taking regular aspirin, junior aspirin 75 mg, Lamiprin, AC beta 5 mg, bisoprol 5 mg, simvastatin to control the lipidemia 40 mg, and nicorandil 20 mg BD. On examination, she had mild epigastric tenderness on palpation. Her heart rate was 68, somehow reduced beat per minute, blood pressure of 120/82 mm², respiratory rate of 20 beats per minute, breaths per minute, and oxygen saturation of 96% on air. Upper gastrointestinal endoscopy was performed, which shows a duodenal ulcer. Hemostasis was achieved at endoscopy. She was started on proton pump inhibitor. What is the best management of her antiplatelet therapy? The answer is A. As you can see, she should continue with her aspirin, because aspirin is not causing any problem, unless if it wasn't working well we could change into clopidogrel, but both are good antiplatelets, so she should continue with the aspirin. Question number 27. A 28-year-old woman has noticed a change in her appearance. Most notably, her clothes do not fit her properly and are especially tight around her waist. Her face appears flushed and more rounded than usual. Despite exercising regularly and eating healthy, her weight has steadily increased over the last 3 weeks. On visiting your clinic, you notice her blood pressure has increased since her last visit, and she has bruises on her arm. She is especially worried about a brain tumor. The most appropriate investigation would be, the answer is E, urinary free cortisol measurement, because this is more likely to be Cushing syndrome. As you can see, Cushing syndrome, how it appears when a person gets increased abdominal fat and gets the buffalo hump, and also the person can get bruises. Yeah. Question number 28. A 34-year-old patient presents to you at the endocrinology clinic. He has had difficulty with erection and sexual desire, as well as low energy. He was referred by a general practitioner after a morning serum testosterone was low. His problem started 6 months ago following increasing symptoms of acid reflux. He also has diabetes type 1. His current medication include Revlimid, Novorapid, omeprazole, and metoclopramide. Capillary monitoring of sugar level has been within normal range, but prolactin has found to be elevated. What is the most appropriate action? The answer is B. Stop metoclopramide. The problem is that metoclopramide tend to cause the elevation of prolactin, and that was the problem to this patient. Question number 29. A 23-year-old woman presents to a clinic complaining of months of weight gain, fatigue, amenorrhea, and worsening acne. She cannot precisely identify when her symptoms began, but she reports that without a change in her diet, she has noted a 12.3 kg weight gain over the past 6 months. She has been amenorrheic for several months. On examination, she is noted to have truncal obesity, sounds like Cushing syndrome, with bilateral papish striae across both flanks. Cushing syndrome is suspected. Which of the following tests should be used to make the diagnosis? The answer is A. Should check for a 24-hour urine-free cortisol to confirm if this Cushing syndrome, and that's how it appears. Question number 30. A 63-year-old woman walks into your consultation room with a 5-year history of psoriasis involving her elbow that has been controlled with topical corticoids and a vitamin D analog. However, in the past 9 to 12 months, she has developed worsening and new lesions involving her knees, gluteal region and scalp. She is increasingly uncomfortable and has noted swelling of her digits with pain and stiffness. She is up to date on all cancer screening and has no sign of systemic infection. Her physical examination is only notable for the psoriatic plaques that are red and scarring and swollen tender tips on both hands. All the following therapies are indicated for worsening widespread systemic psoriatic disease except the answer is E, prednisolone. All other are indicated for worsening widespread systemic psoriasis. Subscribe, hit the bell sign, like and share our video. You're with me, girlfriend Oscar. You're warmly welcome.